I'm going to give it until 12:01. Oh, it's 12:01. Okay. Well, hopefully people can hop right in, follow along. But in the interest of everyone's time, I want to go ahead and get started. So today, as I mentioned, is the first of our Lunch and Learn series. So this is a collaboration among several AmeriCorps programs here in the state of Iowa to provide a series of professional development sessions that are available to all AmeriCorps members in the state of Iowa. So as you all know, it's the beginning of the program year. Um, so we're hoping, as we get farther along into the program year and our programs grow, we'll see participation in these sessions grow as well. So given that it's the very beginning of the program year, we thought it would be beneficial to provide our first session on some resources and benefits that are available to you as AmeriCorps members. I'll start before getting into it by saying I'm Erin Hardigree. I'll be presenting today, and I am the program director for the Iowa Community Corps. So our AmeriCorps program has a focus on food security and resource navigation. So to prepare our members for service in this area, they complete community health worker training so that they themselves can become knowledgeable of the different resources that are available in Iowa and how people can access them. So I thought it was very fitting, given the scope of our program, that I present on this topic specifically. So these resources will definitely be beneficial to you in your AmeriCorps service, but it may be also beneficial, depending on the populations that you serve, to be knowledgeable of the different resources in Iowa and how people can access them. So some learning goals for us today. By the end of this session, we want you to understand the various benefits and resources that are available to you. And very quickly, everyone sees the big slide, right? And not my slide with the notes.
Yep, that's right.
Okay. The big white slide. Yeah, not the notes. Okay. That would be embarrassing. Glad that's the case. Okay. So we want you to understand the various benefits and resources that are available to you, how to access them, and these are the different resources we'll go through. So this is certainly not an exhaustive list, but some good resources to you to be knowledgeable about. First, we will spend a good chunk of the time on the Member Assistance Program because that is a program that should be available to all AmeriCorps members and something that you probably have access to already. And then for those who are serving in a full-time capacity and have children, we thought it'd be important to talk about the child care program. We'll also cover the Emergency Assistance Fund that's available through Volunteer Iowa. And then moving on from AmeriCorps specific benefits, we'll talk a bit about health insurance, navigating the marketplace and applying for Medicaid, as well as food assistance programs, so SNAP and Double Up Food Bucks specifically. And then I wanted to share, as a final note, a resource that I think is really beneficial for finding local resources in your community. So as an AmeriCorps member, um, I believe all programs provide a member assistance program. So this is very similar to, say, an employee assistance program, but it's specifically for AmeriCorps members, and it is offered through America's Service Commission. So America's Service Commission oversees all of the different, or they support the different commissions for volunteer service. And one of the kind of recurring issues that were being reported by various AmeriCorps programs and commissions was that programs were having a hard time helping members find resources to help them complete their service successfully. So there were different life roadblocks that were getting in the way from the members actually being able to perform their service activities. So they wanted to develop a resource to help lighten the load so that members could really just focus on completing their service. So that's how the member assistance program came about. It provides a variety of supports to AmeriCorps members throughout their service term. You should know that your participation is completely voluntary and confidential. So when you sign up for the program, you will have to provide some information, but beyond that, it's completely confidential. So they ask you for the name of your AmeriCorps program, but none of that information is shared with your program staff um, in any way. If English is not your first language, there are also translation services available. And the services themselves are provided through All One Health. And we'll have a slide after we cover the different services and what's available. We'll provide some more information on how to get signed on to All One Health and be able to access these various services. So, the main service and the whole reason the member assistance program was created was to provide mental health counseling to AmeriCorps members. So, Um, you have access to 24/7 mental health counseling over the phone at any time, and you'll be put in touch with licensed mental health counselors for support on whatever you may be experiencing that might be causing any sort of distress. So that's not limited to, but can include having family conflict, depression. Um, Issues in your relationships, struggling with substance abuse, grief, anxiety, work life balance, parenting, stress, etc. Um, it's really meant to kind of be all inclusive. Anything that you might be experiencing that's causing you distress, just know that at any time you can get in touch with a licensed mental health counselor to walk you through that, and you can continue meeting with these counselors throughout your service. And it's also important to note that these services are available to you as a member, but also to anyone in your household. So if your partner, for example, is struggling as well, they could also get access to a counselor. Um, all programs, members of all programs have access to that telehealth mental service option. Again, available 24/7. And there are some programs that also provide access to face-to-face counseling. I believe it's up to 3 sessions, and that is kind of offered on a program-to-program basis. So that would be something, if that was something you were interested in, you'd want to talk to your program staff about that. Um, I will say the face to face sometimes can take a bit longer to be matched up with a counselor that actually lives in your area. So if you're wanting counseling kind of immediately or on a short term basis or as soon as possible, then the telehealth option would be your best bet. The member assistance program also offers life coaching, which is another great service that I encourage all members to take advantage of. So the life coaching helps members and members of their household meet their personal and professional goals. So you'll work with the life coach to actively help assess your current situation, identify your goals, and action steps to meet those goals. Um, so your coach kind of will serve as your accountability partner and help you overcome different obstacles you might be experiencing both in your service and in your life, and can help with transitions, big life transitions, creating better work-life balance, setting goals, improving relationships. Here's just the list of the different areas that a coach can support you with. So it's not only just career coaching, but also life coaching to support you in kind of every facet of your life, from your service experience to outside of that and even beyond into your future. So you get up to 3 sessions with a life coach as part of the program. And again, it's definitely a service I would encourage you to utilize. You also have access to legal assistance. So, um, These resources will connect you with experienced vetted professionals in different topic areas. So this includes a 30-minute free consultation in these different areas. And this is not the only areas, but bankruptcy, divorce, custody, estate planning, and wills. Um, if you have a parent or a grandparent that's getting older and this is something you want to think about, that's an option. Real estate, if you're a renter and you have a tenant, or I'm sorry, if you have a landlord that you might be having a conflict with, you can reach out to the member assistance program and talk with a lawyer to help you talk through what your options would be in those areas. Adoption, elder care. Um, Injury and malpractice. So these are just some of the areas where you can get legal assistance. But if you come across a situation where um, you're not quite sure what your legal options are, you can call and get a 30-minute free consultation to help point you in the right direction. You can also get support with financial assistance. So this includes an initial consultation to discuss your finances, and then you can schedule follow-up meetings as needed. So some of the different topics again would be bankruptcy, home buying if you're thinking about buying a home and not sure where to start, if you have debt that needs to be addressed, if you are having identity theft issues, if you're starting to think about retiring and you're not sure where to even start, you can meet with someone to help you get an idea of what that should look like moving forward, planning for expenses around school, or just developing a budget in general that's going to work for you and your income and your lifestyle. You can work with a professional. Um, so this would be a certified financial planner or certified public accountants and credit counselors. You can meet with any of those professionals for a 30-minute consultation and then follow up. Another pretty cool resource through the program is you can have a personal assistant. So you can actually have an assistant help you with your like day-to-day to-do list. They can help lighten the load by researching the best options for you and your loved ones in different areas. So say you're going on a trip and you need help coming up with an itinerary, they can help you with that. If you need support with household errands and you're not sure who to call, um, you need to get your trees trimmed or something like that, and you just don't even know where to start, they will kind of like do that front end research that you just don't have time for and then tell you what your options are and you can go from there. There are also work life resources. So, work life resources are meant to help you navigate the practical challenges of life. Um, because we know that handling the demands of your service on top of all of the many the many things that life brings can be hard. It can be hard to do and hard to navigate, especially if maybe this is your um, you have limited experience in the professional world and this is maybe your first experience working in a full-time job or something like that. It can be very overwhelming, and so the work-life resources are meant to help you kind of navigate life while also performing your service duties to the best of your ability. So they'll provide knowledgeable consultation and guidance to assist with everyday hurdles, so including childcare, elder care, education, wellness, housing, pet care, transportation, special needs. Um, Sometimes we put off appointments that we need to make or just areas in our life that we know we need to address because um, we have all of these other priorities that just come first. And so the work life resource guides are meant to help you with that. And then lastly, another resource through this program is medical advocacy. So you can work with a medical advocate to help you with all aspects of healthcare. As we know, it can be really difficult to understand and navigate our healthcare system and the choices that you may be being offered for any health concerns you might have. So, advocates can help interpret medical information related to claims, coverage, and a medical diagnosis. And again, this is available not only to you, but to a loved one in your family. So, if you have someone in your household that might be having a medical issue and they're being told information by a doctor and you don't know how to interpret that, your loved one doesn't know how to interpret that, they can work with a medical advocate to help navigate the insurance process, um, get referrals, maybe get a second opinion, coordinate transportation to get to and from appointments. So there are a lot of different ways that the medical advocate can help you. But I think it's a very important resource to know that is available to you if you have any health issues or anything arises, again, for you, but also for maybe a loved one in your family. So we've talked about all the different resources that are available through the Member Assistance Program. So now you might be wondering how to get signed up. It's a pretty simple process. So the first thing you're going to want to do is go to this website here. So that's the All One Health member portal. That is the company that serves as the provider for the Member Assistance Program. You'll click sign up and then you'll be asked for a company code. So here you're going to want to make sure that you list AmeriCorps as your company code, and that's all lowercase. And then it'll also ask you for your program name. So this, you don't want to enter program name, you want to enter your program name. So for my members, they would enter the Iowa Community Corps. So just wanted to make that clear. After you enter the name of your specific AmeriCorps program, then you'll create your login. And after you're in, you'll be in the portal and you can see all the different options that are available. There's also an app that you can download so you can kind of have easy access to all of these resources. And there's also a hotline that you can call. So if you don't want to deal with navigating the website and you just want to talk to someone and tell them this is what I need help with, then you can call the hotline and get connected to someone right away. When you log into, you'll also see there are two options to contact a mental health counselor or get work life resources. These are kind of two of the most popular services that are offered. And so they have these like quick go-to options to get connected with someone. So that is how you access the member assistance program. Anyone have questions about MAP before I go on to the other resources? Okay, awesome. I know that MAP has kind of been historically underutilized in our programs, and I think a lot of it might just be because members in the past haven't known just all of the services that are available. So I'm hoping that by going through each of these resources step by step, that you're inspired to actually um, utilize this benefit because it can be incredibly helpful to get you through your service term. So next, I wanted to cover the Volunteer Iowa Emergency Assistance Fund. This is available to AmeriCorps members in the state of Iowa between the ages of 17 to 25. So members between these in this age range are potentially eligible for up to $500 to support them in the event of an emergency that would potentially prevent them from completing their AmeriCorps service. So we define an emergency expense as any unforeseen, urgent event or circumstance that necessitates immediate financial assistance and threatens a member's ability to continue their service. So, just some examples would be like an unexpected medical issue. That could be for you personally, for a family member, or even your pet, because we know going to the vet can be expensive. If you're having housing issues, um, or transportation issues. If your car broke down, that could be considered an emergency expense. Anything that, is a large expense that you maybe don't have the budget for and is going to, again, threaten your ability to continue your service, could be considered an emergency expense. So these are the big ones, but there is also, the option to add other. And in all cases, you'll just want to provide some documentation to support um, the claim. And I also want to note that these funds are available starting from August of 2025 through July of 2026. So I know that we're in September, but if there was even something that occurred in August, that would be considered an emergency expense. Um, you could still potentially apply for funds through the Emergency Assistance Fund. Um, if you are eligible, the funds are, um, if you're eligible and if you qualify, then the funds are awarded on a first come, first served basis. And you can only apply once for up to $500. So just note that if you utilize the fund once, you wouldn't be able to apply for it again in the future because they want to be able to support as many members as possible in the case of emergency. So here's the link to apply here. You can learn all about um, whether you may or may not qualify, what's considered an emergency expense, what's not. They have a frequently asked questions page that is really helpful for understanding how to apply and determining eligibility. I also wanted to talk a bit about the AmeriCorps Child Care Program. So AmeriCorps um, does offer child care benefits under certain circumstances, and the individual has to qualify. But these benefits are offered through a company called Gap Solutions. So the link is there here on the left. And the benefits for the child care program are paid directly to the child care provider. So the funds don't go to you as an individual. It's paid directly to whoever your child care provider is. And that child care provider needs to be an approved child care provider. And if you're wondering if your child care provider may or may not be an approved provider, there's a portal here where you can find that information out. And the member has to serve at least 32.5 hours per week in one program. So you have to be serving in a full-time capacity consistently more than 32.5 hours per week. Again, that's in one program. So if you serve part-time, in two concurrent programs, that would not qualify. Unfortunately, it has to be in the one program. So you have to be serving in a slot type that meets that requirement. Your program will also have to complete a form on your behalf to be able to verify your service hours and verify that you are in fact meeting that 32.5 hour minimum. There's also an income requirement to be eligible. So the household family income, so this is not just your income solely, it's the income of the entire household cannot exceed 75% of the state's median income. The child must be under the age of 13 and reside in your home. And you cannot be receiving any other child care subsidies in order to get that benefit. So there are a lot of conditions that have to be met, and documentation will have to be provided. But this is an option for those who qualify. Okay, so next I wanted to talk about health insurance because it's a confusing area, but it's necessary. So in AmeriCorps, members that are serving full time, so they're in a full time slot, that means they are serving a total of 1,700 hours, have AmeriCorps health insurance, but members that are serving in different slot types do not. And so those members have to navigate the complicated world of health insurance. But there are a lot of different options, so fear not. I'm going to try and um, explain it in as understandable in a manner that is as understandable as possible. So we'll talk about Medicaid, which is the public option, which you may or may not be eligible, but that is one option. And then we'll also talk about private options. So purchasing health insurance through the marketplace and what that looks like. So if you don't know anything about health insurance, you should know it's not, you're not required to have it, but medical care is extremely expensive. And if you were ever in a situation where you needed it and didn't have health insurance, it can be incredibly costly. And so it's in your best interest to have health insurance. And there are two public options that you've probably heard of. One is Medicare and one is Medicaid. And if you are not sure what the difference is, I'm here to tell you. So Medicare is solely for individuals that are 65 years of age and older. There are some individuals under the age of 65 who may qualify, but that's restricted to certain disabilities or conditions. But in general, Medicare is anybody who turns 65 becomes eligible for Medicare and can access it. So yes, it's the public option for older adults. Medicaid is the option that is available to individuals of varying ages. Medicare is entirely a federal program. It's operated only at the federal level, whereas Medicaid is a joint program that's operated both between um, the federal government and the state government, which means states get to kind of determine their eligibility requirements and they help to administer the program. For Medicaid, people under the age of 65 may qualify, but your coverage is based upon not only your income, but also different factors. So again, Medicaid eligibility is determined by both your income and also your health needs. Again, each state determines eligibility requirements. So it's important to note, like, if you had Medicaid in another state, that might not necessarily mean you would qualify here. But to give you an idea of the different factors that may help you qualify for Medicaid. So children under the age of 21 may qualify, a parent living with a child under the age of 18, a pregnant person, a child currently or formerly in foster care, a person in need of treatment for breast or cervical cancer, or a person who is disabled according to Social Security standards, um, and a person who is blind. So those are all of the non-income factors that could determine if you qualify for Medicaid. And then there are also um, income qualifications as well. So an adult between the ages of 19 to 24 whose income is at or below 133% of the federal poverty line may also qualify. Um, and I thought it would be helpful to just provide some background on the federal poverty guideline because a lot of benefits and programs and eligibility for these different benefits and programs are determined by the federal poverty level. So you've probably heard it being referred to, but maybe didn't actually understand what that means. So the federal poverty line is it's set by the federal government each year, and it indicates the minimum amount of annual income or monthly income that the federal government thinks an individual or family needs to pay for essentials like housing, utilities, clothing, food, and transportation. So these guidelines, they change every year, but they do determine, they affect all of the different programs that use the FPL to determine qualifications for said programs. So you may see this throughout your life, and it took me a long time to actually understand what it meant. So this table shows the federal poverty level. Um, per monthly income for the 48 contiguous states. So for all 48 states, contiguous states, the federal poverty level is the same. And then it's different for Alaska and Hawaii. It's slightly higher for those states because the cost of living is higher there. So if you are at the federal poverty level, that would mean your income is $1,304. So that is 100% of the federal poverty level. And then 133% would mean you don't quite make the, you're not quite there. You're at 133% of it. So I just thought it would be helpful when you are maybe navigating different benefits and resources, whether it's for you or for a client or someone that you may be serving or supporting in your service, to understand what those numbers mean in terms of qualifying for different programs. So you can refer to this table. So if you think you may qualify for Medicaid, um, here is the link to go to the HHS self-service portal homepage. So you can do a pre-screening and just check your eligibility just to see if you may be eligible. Or you can click apply for assistance and you fill out an application, and I believe it will be considered for all different benefits that are available. So it's includes not only Medicaid but SNAP and other assistance programs. If you apply for one, you're kind of applying for all to see if you're eligible. And it doesn't hurt to apply to understand that process. And again, depending on the type of service that you're doing, it may be beneficial to just understand how that process works in helping others. Again, so if you are interested and think you might be eligible, now's a really good time to apply because if you're not, open enrollment for the marketplace insurance opens up in November. So this is definitely the time that you would want to consider applying. I also wanted to just talk really briefly about Hawkeye. So Hawkeye is like Medicaid, but for children. So if you have children and you are uninsured, underinsured, your child may be eligible for Hawkeye. It's not as restrictive as Medicaid, so a lot more children are able to qualify for it. And it covers children under the age of 19 who are in working families that maybe have too much income to qualify for Medicaid, but cannot afford private health insurance. And no family pays more than $40 a month. So some families pay $0 a month, some pay no more than $40. So it's definitely a great option and is more accessible than traditional Medicaid because it's specifically for children. So again, Medicaid, there are a lot of different factors that determine whether or not you may or may not be eligible for the public health insurance option. But if you choose to apply and you're not eligible, don't worry, you still have a lot of options. And you can most certainly get insurance through the healthcare marketplace. So that means you're just applying for private insurance. But there are tax credits available that actually make your premiums much more affordable than what you might be thinking you would have to pay. So open enrollment takes place from November 1st through January 15th. Our health insurance system is really confusing, and for some reason, there's a certain amount of time during the calendar year where you can actually apply for it. So that is, we're coming up upon it. So this is the time. To opt in if you are wanting to get health insurance. There are other times of the year where you may be able to apply in the marketplace, like if there's a health issue or if you lose health insurance, like say you had health insurance through another job and you lose it, then you can apply outside of open enrollment. But in general, you want to apply between November 1st and January 15th. You apply directly at healthcare.gov or you can call 1-800-318-2596 to find and compare different plans. So you will have to provide some information and then navigate all of the different plans that are available and pick the right one for you. So that can seem a little overwhelming, and I have some resources to help with that. But I wanted to note that 90% of people who enroll in the marketplace in Iowa qualify for a subsidized premium. So the premium that you see um, being advertised to you when you're in healthcare.gov is not actually the premium that you're going to pay. Um, and based on your income, you'll be eligible for a tax credit to support your premium. And for those who might not know your premium, that's the monthly payment that you have to pay each month to have and keep your health insurance. And 31% of individuals paid less than $10 per month after those subsidies. So, depending on your income and your unique health situation, um, you could pay as little as $10 per month. So I know people just assume that they can't afford private health insurance, um, but oftentimes because of that tax credit, you can. So if you're interested in learning more about health insurance in Iowa specifically, this website here just has a lot of really great information about navigating health insurance here in Iowa specifically, what the laws are. Um, Definitely a great resource to refer back to. And again, if you're like, I don't even know where to start, even like going to healthcare.gov, I don't even want to do that. You can find people that will help you through this process. So you can go to this website here. I've provided the link up at the top. Um, but healthcare.gov offers a resource to find people that will support you. So either an agent, a sister, or a broker. So if you enter in your zip code here and hit search, you will see a number of different either assisters or brokers. So I wanted to just quickly differentiate between the two. Um, an assister is typically from like a nonprofit organization or a community health clinic. So they have staff on hand that will help you through this process. Um, and um, they are not kind of benefiting from it. Whereas a broker, um, typically they will make a commission off of the sale. So you don't have to pay them, but they'll make a commission based on the plan that you select. And so there's kind of pros and cons to each. There are definitely a lot more brokers than there are assisters. Um, and so depending on where you live, if you live in like more of a rural location, you might not have an assister in your area, but you may have a broker. And also, an assister, they're helping a lot of people and there are less locations. So there may be, might take longer for you to get connected with that assister versus a broker would probably be much quicker and easier to access. And they also may be really knowledgeable about the certain plans that they sell, but the assister is not, they have no incentive to sell you a specific plan. So they're going to kind of be able to help you and provide a more non-biased support in that process. So just important when you do put in your zip code here, you'll see different options. Some will be assisters, some will be brokers. So just keep in mind what the differences are there in making your decision for who's going to help you. But they will sit down with you step by step and help you go through the different plans and decide based on your budget and your health what the best option is. Another public benefit that you may be eligible for or may consider is SNAP. So SNAP stands for the Supplemental Nutrition Assistance Program. Um, with SNAP, participants get an EBT card that stands for Electronic Benefits Transfer, and they can use that card to purchase groceries directly at a grocery store or at a farmer's market. And eligibility, again, is determined on a lot of different factors. So it's not just determined on your individual income, it's determined by the entire household and different factors. And going through this process, I will just say it's a bit of a process when you're applying. You need to verify your income by providing pay stubs, rent receipts, bank statements. And then once you apply, um, someone will call you to complete a follow-up interview, and you want to make sure that you answer the phone um, when that person calls to do that follow-up interview. If you don't, um, HHS will leave a voicemail telling you that they'll call back and when they're going to call back. So make sure you answer that call. Keep your phone on you at all times. If you miss the call, it kind of restarts the clock and then you have to start all over again. So just important to know that. And the process can take up to 45 days. But if you are accepted, you'll be notified by mail that you're approved, and then you will have to renew your benefits on a regular basis. So if you're interested in applying for SNAP, um, really helps with that household budget to have those extra funds for food specifically. You can either apply online um, through that portal that I showed you for the Medicaid assistance. You use the same portal to apply for SNAP. You can get a paper application and email it or fax it, or you can call directly. Sorry, the number to call is up here um, between the hours of 8 a.m. to 5 p.m. Monday through Friday, and someone will help you and walk through the application with you. And then you can call this number to check on the status of your application over time. And if you mail it in, here's the mailing address. I also wanted to note really quickly that because you're an AmeriCorps member, your living allowance payments are not counted towards your income when you're applying for SNAP. So again, because you're an AmeriCorps member, the federal government has identified certain benefits through um, the National and Community Service Act of 1990. So um, the National and Community Service Act of 1990 authorizes AmeriCorps members to have these additional benefits. So it states that allowances, earnings, and payments to participants in AmeriCorps programs, so in AmeriCorps state and national programs, shall not be considered income for the purposes of determining eligibility for and the amount of income transfer and in-kind aid furnished under any federal or federally assisted program based on need. So that's confusing, but what that ultimately means is that as an AmeriCorps member, the living allowance that you receive for your AmeriCorps service is not counted towards your income when you're applying for federally funded need-based programs. So that includes SNAP. So if you have a second job, or if you have someone in your household that has other jobs, their income will be counted towards your eligibility. But the living allowance that you receive solely from AmeriCorps is not going to count towards your income. So that increases the chance that you may qualify for SNAP. And then other federal programs where the same is true. It would be applying for WIC, HUD housing, veterans benefits, and need-based student financial aid. So that is kind of a huge benefit to serving in AmeriCorps if you're applying for any of these, again, federally funded need-based programs. I also want to know, in case we have VISTA members on this call or watching this call at a later time, um, it is different for VISTA. So this is specifically for AmeriCorps state and national members. Um, the rules are a little bit different for VISTA, but so there are some programs that VISTA members have an advantage and some where state and national members get the benefit. It's a little confusing, but there is a guide that Volunteer Iowa has created that has a breakdown of all of the different federal programs, benefits programs, and then um, whether income counts towards um, the qualifications for both Vista and state and national members. So I'll make sure that that form or that table is made available so that if you are a Vista member or a state and national member, you can look through that and see which programs you may or may not qualify for. Um, Another benefit is the Double Up Food Bucks program. So if you are um, a SNAP participant and you're receiving that benefit, your SNAP dollars can go twice as far when purchasing fresh fruits and vegetables at a participating grocery store or farmer's market. So definitely a great way to make your SNAP dollars go even farther. For every $1 that you spend on fresh fruits and vegetables, you get an additional dollar in Double Up Food Bucks, and you get up to $10 per day. So it's really incentivizing you to use those SNAP dollars towards fresh fruits and vegetables. If you're interested in using Double Up Food Bucks, you can visit the website. The program is operated through the Iowa Healthiest State Initiative, and you just have to be sure that you're purchasing those items at participating groceries and farmers markets. So Fairway and Hy-Vee are the grocery stores that participate in the program, and then there are a lot of farmers markets that participate as well. And then the last resource that I wanted to share is the Together We Care community resource. So this is a free tool that is offered by Unity Point, and it's really just a database of all of the different organizations in Iowa that offer various supports. Um, so you can enter in your zip code to find local resources for a variety of needs. Um, and you can search for free or low cost programs for help with food, housing, transportation, healthcare, and more. So it's really a way to find local resources. And I thought it would be good to just show you quickly what that looks like. So this is the portal, and you'll just want to enter in your zip code. So I'll enter in the zip code for my office. And then it's going to show me that in my area, so in the Des Moines metro area, there are 2,620 programs that offer different resources in these different areas. So for food, um, there's one community garden locally. For emergency food, there's 12 options. Food delivery, 16 options. So I can just click. So say I'm trying to find a food pantry. It has to verify that I'm a human first, of course. So if I'm trying to find a food pantry, it shows me the map of where they all are available, and then I can scroll down and find the one that's closest to me. It tells me when they're open, um, when I can access it. So like some food pantries, you can only go once a month, or some you can go at any time. So you can see all of the different options here and their operating hours. You can do the same if you're looking for help paying for housing or other home costs like internet, phone bills, utilities. Um, the list goes on and on. So help finding bus passes, help paying for your car. There's all of these local organizations um, that are also providing supports beyond the options that we discussed today. So there are a lot of resources out there, and a lot of the times it's just a matter of um, navigating them and finding the right one for you. So this is a really, really wonderful resource to utilize if you are in need of any type of supports. So that could be healthcare, direct financial support, childcare, elder care, education, on and on. So just a great resource that I wanted to make you all aware of. And I'm going to stop sharing my screen now. We have about 10 minutes. I just wanted to open it up for questions if anyone had any.
We have one, Erin.
Okay,
Hi, how did I get to that last site that you were talking about with the resources?
I will put it in the chat here. Um, but it's also, so I'm gonna make these slides available so your program staff can share the slides out, and the slide and the all of the resources that I shared today are available in those slides. Um, but it is unitypointhealth.findhelp.com. So yeah, I've shared a lot of different links to a lot of different resources today. So I'll make sure that you have access to the slides so that you can refer back to them. But yeah, when I found that website, it like blew my mind. It's really helpful. Any other questions about health insurance, member assistance program, any other benefits or resources that we just didn't have time to talk about? There are a lot more. We kind of just covered the basics today. Okay. Well, thank you all for attending. I appreciate you all being here today. We will share the recording and make this available in case you want to give it a rewatch. And then other members who weren't able to attend today will be able to watch as well. So thanks again. Enjoy the rest of your day.